Hello everyone, this is Angela and welcome to my channel, Angie the ENTJ. Please be sure to like, subscribe, comment, and click on the notifications bell so you'll know whenever I upload any new content. I am going to do a brief commentary about the story on the United Healthcare CEO's unalivement in one of the busiest parts of one of the busiest cities on the planet Earth, New York City, particularly down in Midtown Manhattan. First, I want to offer my condolences to the family and the friends of Brian Thompson. That said, it is time to get into some grown folks conversations about this situation, and I'm going to forewarn you, this may be a trigger warning, okay? So, from my perspective, the American society has some bad habits, and one of them is waiting until crap hits the fan before acting. And it usually comes in the form of people being unalived first before there's panic and then action. It's different from procrastinating. This right here is more sinister, and it is quite abusive in the form of neglect. It's already happened back in the day with workers from the post office being stressed the heck out and then being fired while under that kind of stress from their jobs. But after a series of former postal workers who were fired started blasting up their workplaces across the nation, it was then and only then when the U.S. society began to take mental health more seriously, and that U.S. officials began to accept the value of mental health treatment. As a result, postal workers can now get unlimited sessions of therapy. Most places will only offer 6 sessions per year. I forget the name of the program that most employers have, but anyway, most of them, they only offer 6 sessions each year. But for the postal workers, listen, so long as they are employed with the post office, they have unlimited therapy sessions. Not only them, but the people who also live in the same household as they do can get therapy sessions, even if they are not related through blood or marriage. Just so long as they reside under the same roof, they can get therapy sessions too. All they have to do is just prove that they live at the same address as the postal worker, and they can get all the therapy in the world that they need to, if they want it and if they need it. So what happened is that a lot of funerals had to occur before they began to take the mental health, the stress that the postal workers are facing, before they began to take it seriously. And now that they're taking it seriously because some people are unalived, now you get unlimited everything. It doesn't have to be like that. If the citizens of the United States had universal health care coverage, then I strongly believe that Mr. Brian Thompson, the United Healthcare CEO, he may have still been alive to see another day and to spend Christmas with his wife and his 2 sons. They probably would have been in New York City next year at the Rockefeller Center seeing the Christmas tree lit up, because that wasn't too far away from where his life was taken, by the way. You see, some people have conditions that require medications that cost thousands, if not millions of dollars, and I'm being literal when I say that. One medication called Unalived cost $4.25 million because it is a form of gene therapy, and it's used to correct the genetic condition called metachromatic leukodystrophy, or MLD, and it can be fatal. And the reason why it's fatal is because it can lead to the excessive buildup of fats. A person is born with it. Now, Unalived is a one-time treatment that is administered to children to correct the genetic defect. But the average American does not have that kind of money laying around. With universal health care, the cost of those kinds of treatments for these rare but expensive conditions are spread out over the population, as opposed to having an average family try to figure out through GoFundMe's, through working extra shifts and so forth, how to cough up that kind of medication. or how to cough up that kind of money for medication. Linmeldy is the most expensive medicine, but there are also others that cost in the millions of dollars or the hundreds of thousands of dollars too. Can you imagine being a person who needs this treatment that may save your life, but you cannot afford it? And it's not a matter of, if I try this treatment, it might save my life. No, it's already been proven that it will, but you just need to pay for it and you don't have access to it. Can you imagine being a person who needs this treatment and you cannot afford it? Or worse, being a parent to a child who needs that medication that can help to save their lives, but the coverage is being denied from your insurance company. So day by day, minute by minute, you are watching slowly as your child is slipping away to the afterlife. Listen, let me tell you something. Losing a child is an unbearable pain that I would not wish on my worst of enemies. I'm not that mean and I'm not that cold. It is an unbearable pain. It messes with you. And no, you can't just ever get over it or think that you can just try again for another one and the new one will help you to forget the old one or the one that's no longer here. Because each child is different in their own little special way. Listen, I do not know what compelled the shooter to unalive the CEO of United Healthcare. And regardless of his reasons, he was wrong for pulling the trigger. However, the worst offenders in this scenario are the people and the politicians they voted for who are against having universal health care here within the United States. Some of the insurance plans available to people cost more than $600-700 a month. And they require you to pay a nearly $10,000 deductible before the insurance company will begin to pay out from the policy. So, in other words, if you're going to the doctor, you're paying out of pocket up to $10,000. And it's only after the $10,001 that the insurance company will start covering what you need to get, on top of you having to pay $600 a month. And in order to not have to pay that $600 per month, which is sickening in and of itself, just for one person, you have to be poor enough to qualify for a discount or for Medicaid. It's backwards. It's so backwards. More and more things like the unalivements of CEOs will continue to happen if steps are not taken to institute a better way of doing business like the Nordic model. And just for clarification, that statement I just made right there, it is an observation from my part on how typically events tend to play out. Like, I'm just basically saying that's how the ball rolls. It is not a veiled threat or anything like that. I don't advocate for violence. What I am saying is the equivalent of 2 + 2 = 4. As far as if steps are not taken now, then more people will take matters into their own hands. So an ounce of prevention is better than a pound of cure in this situation. I'm not telling people to take matters into their own hands. I feel the need to say that before someone tries to report this video as advocating for stuff that it's not. Anyway, some people believe that having social safety nets like the Nordic model as it pertains to healthcare and education and housing and so forth will encourage mooching and laziness and slacking. Yeah, sure. There will be a rare handful of individuals who will behave like that. It will be about as rare as the number of women who use shun as birth control. The reality is that when a population is healthier, more educated, wealthier, and have stable living conditions, they tend to become more innovative and tend to become more technologically advanced. Here, let's watch a quick video of a man that was paralyzed for 12 years. Let's watch him walk again, and then I'll be back.
So there it's picking up well.
For more than a decade, Gert-Jan Oskam has been trying to relearn to walk. A motorbike accident in his late 20s left him paralyzed from the hips down, changing his life forever. But now, Oskam is back on his feet, thanks to groundbreaking digital implants in his brain and his spine.
After 2 days, within 5 to 10 minutes, I could control my hips.
It works like this. When Oskam thinks about taking a step, a brain implant picks up the signals and sends them to a computer strapped to his back. The computer decodes it, then transmits the signal to a device in his spinal cord, triggering his legs to move. Scientists say it's like a digital bridge that bypasses the damaged part of his spine.
The patient has first to learn how to work with his brain signals, and we also have to learn how to correlate this brain signal to the spinal cord stimulation.
Scientists were shocked to find it may have helped close the gap in his nervous system.
I'm here.
In less than a year, Oskam gained the ability to walk with crutches even when the device is turned off. Life-changing abilities he didn't have after a previous experimental implant, which only let him take a few clunky steps.
I am in full control of what the stimulation does. And that gives me a lot of freedom, which I didn't have with previous therapy.
Researchers say it's an incredible step forward from older technologies that could detect brain signals or stimulate muscle movement, but not both.
Putting all those components together in a human with spinal cord injury and having them talk in quasi real time, it's a breakthrough, really.
It's not a cure. Oskam can still only walk several hundred feet a day and stand without help for a few minutes. But for the first time since his accident 12 years ago, Oskam can do things most of us take for granted, like get out of a car or stand at a local pub.
It was a long journey, but at the end, I can really build functional things from it.
A long journey now giving hope to other patients still striving to take that first step.
Okay, so I'm back. This man is Dutch. He's in the Netherlands. And the Netherlands is a place that ranks number 10 on the United Nations Human Development Index. The Netherlands is not a Nordic nation, but they do have strong social safety nets, including a service called Kramzorg. The Kramzorg is a trained professional who helps new families adjust to having a new baby, and the service is provided for 8 days. The Kramzorgs help with the baby, also help to do some cooking, cleaning, maybe a bit of laundry, but most importantly, they help the new parents adjust to having a new baby in their home. And this service is provided at no fee each time a family has a child, because they understand that getting a new baby in the household that already has children has its own unique set of challenges to have to navigate. So for those individuals that are shouting about it being communism or socialism or charity, when the fact is that it is all taxpayer funded, or that having universal health care as well as other programs to help everyone within the society, including their own selves, will lead to everyone becoming lazy or useless over time. Well, listen, they are saying more about themselves than they are about the reality on the ground. In the Netherlands, instead of people working 20 hours per day in order to survive, people can gain an education and then work together as a team to get a man who's been paralyzed for over a dozen years to be able to walk again, which would mean that he would need less assistance than he would require by remaining as a paraplegic. He can now probably get up and go to the bathroom by himself, as opposed to having someone clean his bed and change his diapers. He could even get out of a car by himself, as opposed to having another person throw their back out, helping him get into and out of a car. See, if we over here in the U.S. got our act together and thought more in alignment with the citizens of the Nordic nations or places like Switzerland or the Netherlands, then we all would be better off, and the UNHDI proves it. That's why I think that people like the governor of Texas, Governor Greg Abbott, Freudian slip there, is using his disability to mask his personality. He's a mean bastard who would, rather than figure out how to walk again and make the lives of Texans better, he wants to disable other people in his own way. I have nothing against people living with disabilities. That's not why I said what I just said. My grandfather was a disabled man, and he was not a mean person to other human beings. If you crossed him, he could show you something, but for the most part, he was cool. Greg Abbott, on the other hand, is a mean person who hides behind his disability. And people like him are the reason why the U.S. is the third world of developed nations. I fault people who think like Governor Greg Abbott the most, the so-called conservatives, for the unalivement of the CEO of the United Healthcare Company. I'm faulting the person who aimed the pew-pew, but I fault the conservatives the most. And for the unnecessary suffering and for the preventable unalivements as well of people, especially the 3 women in Texas so far that could have been alive had they received the proper care during experiencing a miscarriage. Listen, the truth does not need an ideology to validate it. It is self-validating. This Dutch man is walking again due to educated people concentrating their efforts for a good cause. The 3 women in Texas who passed away because of a treatable infection that could have been prevented had they received care earlier on due to a miscarriage, they all could have been saved. And the CEO of United Healthcare, along with 335,000 other people, may still be alive today if every citizen had universal health care in this nation. And on top of that, we would have saved nearly $500 million in costs, according to the study conducted by the Yale School of Public Health back in 2022. So that's all I have to say for now. Please be sure to like, subscribe, comment, click on the notifications bell so you'll know whenever I upload any new content. Take care until next time.
Well, I'm gonna stay right here where I'm at.